one thing we did really early on, because, we didn't have any money, we were doing this kind of on evenings and weekends. So we actually just cold emailed and cold outreached a bunch of folks who we wanted to bring on as clinical advisors, people who we really respected, who, we just respected their perspectives. And we were very, very fortunate that there were a number of providers who just said, yeah, this is a huge problem. There's a huge access barrier. This is an awesome idea. And really just early on, kind of volunteered their time and shared their perspectives. And we would kind of go through and brainstorm and kind of design a care model, review it with them. And then ultimately that became our care advisory board.
Hi, everyone. Welcome back to the Playbridge podcast. Today, we are joined by Joan, the co-founder and CEO of Arise, whose vision is to create a world where everyone has the freedom to heal from eating disorders and disordered eating. Joan previously led product at Headspace and holds a BA in psychology with a minor in CS from Harvard. She is also a published author on the mental health experiences of Asian American students at Harvard. So impressive. I'm so excited to have you here today. Thank you for joining.
Thank you for having me. I was telling you earlier, but I'm just so honored to be on your podcast and also just appreciate the vulnerability and the stories that you share and the leadership that you highlight. So excited to be here.
Amazing. Well, honored to have you. To kick it off, will you share your first vision for Arise and why you wanted to build this business?
I went through my own experience with an eating disorder when I was a freshman in college. And at that time, I didn't really have any family support around eating disorder care. My parents didn't talk about mental health. We didn't grow up really understanding what mental health really was. And so ultimately, I was navigating a lot of that on my own. And so there were three barriers I really like to highlight. One is financial barriers. As an 18, 19-year-old trying to kind of figure out the bills and how insurance works, it's really overwhelming. Second area is really just accessibility. At the time, I had to go to a campus hospital every single day for appointments, and they were in a very public waiting room with a lot of other people who were coming in and out. And it felt like every time I was going to an appointment, I was going to be outed. And then the third area that's really pivotal to kind of why I started Arise was the lack of cultural awareness among the clinical staff. I don't think there were any providers of color on that team, and that had really tangible impacts on my treatment experience because I had a dietitian who's very well-intentioned who the kind of default method is this thing called the plate method. And it's, you have your plate, they tell you to have a certain amount of food. And I remember just thinking, well, I'm going to throw this piece of paper away because my family eats very family style and it's very communal. And so things like that, where it just really wasn't working for me. And at the end of the day, I just thought I'm not a good fit for treatment. Like I have to just figure this out on my own. And so it resulted in more than a decade of really just kind of figuring it out on my own and piecemealing together providers. And ultimately I was like circling in and out of ERs, urgent cares. And so I thought for a long time that was my own isolated experience. And it wasn't until I got involved with a nonprofit called Project Heal that really focuses on breaking systemic barriers to eating disorder access, treatment access, that I really just realized like my story is not an isolated experience. It's something that so many people go through and struggle with. And there were systemic barriers that really were making it harder for people to find healing. So that really became the inspiration to do something more. And I remember the exact moment and thought that I had. I was sitting in a room and I was just reflecting on my healing journey and thinking that in some ways, like my experience, at least with the eating disorder, was me trying to shrink my presence in this world. Shrink, and then that was literal, and also shrink my voice in this world. And how unfortunate that is, especially as a woman of color, that we worked so hard to be taken seriously, to have a presence, to be leaders, that I was still feeling really controlled by this and still felt like I had to shrink myself to be respected, to fit in, to really assimilate. And so that was something I was like, well, this is just BS. Like we shouldn't have future generations still struggling with this. And we really need to do something different to create a better world. And so that really kind of became my moment when I realized like I have to go and do something. If there's anything I do with this life, it is, how can we really change and shift our perspectives to really honoring and respecting people's character and their voice and their thoughts and opinions, and not judge people by their appearance.
I mean, I think pretty much anyone has either personally experienced disordered eating or knows someone close to them that has. I think it's like a much larger problem. And maybe that just goes back to people are not talking about these issues. At least, definitely when I was younger, it was not a topic of conversation, even though I knew tons of friends that were experiencing these problems. How did you first realize that like you weren't the only one kind of going through these struggles? And how did you, find community and learn how to heal?
Yeah, that's a great question. I was really lucky that when I was in college, a very dear friend of mine, we were just walking back one day, and she had previously had an experience with an eating disorder in high school, and she just kind of called me out on it and asked me directly, like, are you struggling with an eating disorder? And I remember at the time kind of saying, I remember it differently. I remember saying yes, but she was like, no, you like said no, when we were reflecting on it. But I think that was the first instance where I realized like, oh, okay, like I'm not alone in this and I have someone I can talk to about this. And I think really it was wild because even after that, for the 10 years, like I really didn't tell anyone besides the people closest to me. A big reason for that was my mom had actually said, because she just didn't understand how eating disorders worked or how they would be perceived. She was like, just don't talk about it. It's really stigmatized. Just keep it private. And so I did. And it wasn't until actually the pandemic that I met the CEO at Project Heal at the time. Her name is Rebecca. And we just got to talking about it. And I just unleashed my entire story and experience. And honestly, I felt so much more free once I did. And I think the more I started practicing how to do that, she invited me to speak on it on an Instagram Live. And after that Instagram Live, there were so many friends of friends who reached out and said, I've gone through this, or I have a friend who's gone through this, or my siblings going through this. A lot of people who I had worked with, in the past careers, and we worked at mental health companies, right? And so you would think that these things would come up, but even there, like it was so stigmatized still. And so I think the more I realized, like, opening up and sharing my experiences vulnerably, it gave space for other people too. And honestly, it just kind of created a community where we could really be support for one another.
Do you have advice for someone that might have a friend or a family member who is going through something like this? And, I think I personally had friends and family honestly go through eating disorders, and it's like you don't quite know how to approach or help them go through this. What advice would you have for people in that situation?
Yeah, that's a great question. I think the biggest piece is really respecting that individual still. Like I think there's a common narrative that that's the eating disorder voice talking, like you can't trust them, you can't trust that voice, you can't trust yourself anymore. And I think it is a disease and a condition, right? But I will say, especially when we look at diet culture and how that pervasive that is, it's in many ways like it's a kind of a rational reaction to want to fit in or to be well perceived, especially when we consider gender dynamics and race dynamics. And so I think part of it is really understanding that there is a very often valid reason for why maybe this eating disorder is a helpful coping mechanism for them. And so I always like to really advise folks to just like approach it with a little bit of curiosity and ask them like, how can I support you? Would this actually be helpful or not? I think for me, when I was recovering, it was really helpful to just like have someone to debrief with afterwards. And for example, we're going into like a family dinner. We know that XYZ relative is going to say something wild and it's going to be really triggering. And there's a lot of anxiety that comes up before, during, after that dinner. And knowing that you have kind of a safe person who knows what you're going through, who you can talk to afterwards, and like who can validate, that was a really messed up thing for this relative to say. That made really all the difference. And so I think, how finding ways to be that safe person, to approach it without judgment, to not try to solve it, because you probably aren't the right person to go and solve that. There are clinical professionals who do that, but really being someone they can trust and share how they're really feeling, and providing kind of that comfort of being able to be open with someone.
To your point of diet culture, what are some common triggers that may lead to disordered eating?
I think that there's a variety of different things. I think first and foremost, with social media, with all the things that we see in media, right? Like if we're constantly consuming content that is telling us that being in a smaller body is better and more attractive, and that is what we are constantly inundated with, then, I think inevitably that kind of seeps in. And so I think what I always really try to do for myself is, if there's someone who's promoting something that I'm like, this is, I know this is not good for me. A lot of times you see that in like the fitness industry, like well-intentioned people, but for me right now, like this is just not a good fit, and I need to unfollow. And finding folks who really do share the same values that I do, and that is, being able to really love yourself for you and not for your body, and not framing your body as a good or a bad. Like, it is just a body, and you are so much more than that. So I think social media can be a really big trigger, but I think oftentimes we put all the blame on social media, but really social media is kind of a reflection of broader society and like other humans in society. And so I think it comes up a lot in conversation. I mean, I think even in the over holidays, right? People saying like, oh, I ate so much, like I'm not going to eat tomorrow, or I have to go work that off. That's a very common thing that we hear. And maybe that one comment is not indicative of an eating disorder, but it is very much a part of diet culture. And for someone who is struggling with an eating disorder around you to hear like, oh, I'm not going to eat tomorrow. They're like, oh, well, maybe I ate too much too. Like I shouldn't eat tomorrow. There is this feeling of, oh, like eating is just inherently like a bad or a good thing. When really eating is just about like, we need to nourish ourselves. Eating can be, a joyful experience. It can be something cultural that we share. So I think that can be a really big trigger. I know for me personally, sometimes just seeing old photos would be really triggering for me. And so it took me a really long time to just start to feel neutral. And so I think there was a period of time I just had to kind of, limit some of the photos I would see. Like when someone would take a picture, I would just not look at it, and it just exists, but I don't have to really confront it. And I think what was really interesting to me is after I really felt healed, I look back at these pictures and I would just feel fine about it. Like I didn't feel like, oh, I look so good or I look so bad or whatever. It was just like, oh, that's a picture of me. And I think that has really been indicative in my own journey is being able to just be like, oh yeah, that is me. And like, I don't have to feel worse because I'm in a different size of body now. I'm more than that. And so that has been really, really helpful. And I think oftentimes a lot of eating disorder triggers can come from family members and a lot of just intergenerational trauma and also just disordered eating behaviors. And so, I think to your point earlier about how can you support really like kind of helping your family members to really defy some of those narratives that we've created around what beauty means, what health really looks like.
So you touched on this earlier, but prior to Arise, what were kind of the options for people looking for help out there? And then how is Arise doing things differently?
Yeah, I think the reality is just that there are so few accessible eating disorder treatment options. The stats are really staggering. So 30 million Americans will have an eating disorder in their lifetime, 5 to 6 million newly diagnosed every year. Yet 80 to 90% will never be able to access care. That's staggering. And so, when we look at why that might be the case, I think first and foremost, care is just so expensive. So most people are really not able to access treatment until they're reaching a crisis point, whether that's residential or inpatient care. Stats are, it's incredibly expensive. It can be upwards. I think the estimates are around $80,000 for kind of a single episode of care. But oftentimes people are going through multiple cycles of that. So to actually reach healing, the estimates are really about $250,000. Some of
Wow.
that's hopefully covered by insurance, but sometimes people don't have that insurance coverage, or it is only temporary. And so that is a huge reason why people won't get care. And even though that there are lower acuity options available like outpatient or IOP, IOP, they're very limited treatment spots. And for outpatient, it's often pretty disjointed. You have to pull together a therapist here, a dietitian here, and try to help them coordinate. And so that becomes really challenging for patients. So that's kind of the landscape we were really entering. And so really our idea with Arise was, how do we really make care easier to access earlier on so people don't end up in the hospital? And so our program is, we call it Outpatient Plus, and Dr. Erica Taylor is our chief medical officer, and she's a psychiatrist by training. And she really designed our entire clinical program to be vastly different, where It is, a coordinated clinical team of therapists, dietitians, psychiatrists, primary care doctors. They're all within the same group, Arise, and they actually have regular touch points to really think through and problem solve together. What's working and what's not working. And I think what's also really important is we have community care integrated into that clinical model, and so that is led really by our care advocates who are peer supporters. They have their own lived experience, which is so important because people feel so much more understood. And that team is led by Jiva Wilkerson, who's an eating disorder recovery coach and is incredible leader. And I think really being able to bring together this team that I think just leads from a place of understanding what it feels like to have lived through an eating disorder has really allowed us to build an experience that feels a lot safer for people to embark on. And I think the other really important piece is we accept insurance, including Medicaid. So most states that you go to, there are maybe one or two, if any, eating disorder providers, and they're typically, a single therapist. There really aren't any comprehensive eating disorder programs that accept Medicaid. And so for us, that was really important from the get-go because that population is probably twice as likely to develop eating disorders because of things like food insecurity. Yet they're only a third as likely to be able to access care compared to a commercial population.
And is all of your care virtual, or do you have any on the ground touch points as well?
Yeah, for right now, we're all virtual. And I think that's really allowed us to pull together the best of the best from all different areas. And right now, we're delivering care in Texas, North Carolina, about to expand to New York and Florida, which I'm really excited about because we just see so much need in these states. And there's also I think, these states are also the home of some of the most diverse communities. And that's a huge emphasis for us is really reaching historically underrepresented and underserved communities.
What was the reasoning for North Carolina and Texas to start?
Yeah, definitely. So, I think the easy thing is I'm based in Texas. Our chief medical officer is based in North Carolina. So we had really just deep connections with a lot of the local providers, hospitals in the area. But I think the other piece is really thinking through, Texas is I think it's like the second to last, if not last, on quality of mental health care services. So there's a ton of need here, we know, and also really diverse populations, especially within Texas. We have a lot of rural deserts, I would say, where, there just are no providers. And so you have hospitals really struggling where someone's stepping down from, inpatient stay with eating disorders, but they don't have anywhere to really send them for ongoing support. And so people, unfortunately, it becomes really chronic. So that's been a huge area where we've been able to step in and support.
Love to go back to the very beginning of Arise, kind of walk us through how did you get the first product off the ground? What did the very beginning of the business look like?
Yeah, I sometimes look back on those days so fondly because it was just endless opportunity. And it was the most fun part because it just meant that we got to go talk to other patients, people with lived experience and within the community, and really just get to learn about what worked for them and what didn't. And it was just really honestly humbling to just learn and hear more about all the different barriers that people experienced, and also how they found creative ways to find to bring healing for themselves. And the resounding thing that we really heard through all of our user interviews were community and being able to connect with someone who really gets it in a way that sometimes clinical teams just don't because they've never lived it. That was just a common theme throughout. And so that was really the reason why we actually started with just a care advocate community support program. This was the summer of 2023. And so we launched it. It was a completely free program, really focused on supporting BIPOC folks. And just understanding how does this actually make it a little bit easier for people to start that process of seeking treatment? Because one of the findings we had in research was a lot of the people who were coming in, they just never even thought that eating disorder treatment was an option for them. It was just, it was too expensive. They already knew that. There was a lot of distrust, understandably so, of the healthcare system. And so starting with this community care allowed people to really rebuild that trust. And what was really cool is at the end of that program, a lot of people were then ready to go into clinical care. And so then we immediately were like, okay, we got to build out this clinical team. And so then we really kind of hit the ground running and had this kind of full comprehensive program of community care with this clinical care. And what's been really, I think the most exciting part is to really see how that team has really come together in such a unique way, because most eating disorder treatment programs are so hierarchical. It's like your doctor is the head of the team, and then you have everyone else, and then your peer supporters are sometimes like not even involved in the conversation. I think what's really cool here is really removing that hierarchy and having providers who are honestly just so humble and like collaborative has been really awesome, because they get to really think about things differently. It's not just, oh, well, this person, like I've seen a million cases like this is what we do. We really get to hear from the care advocates on what's working, what's not working, what are some of the barriers that the patient might experience. And I think it really just brings the entire team back to the heart of why we started this work. And there's someone really, focused on building that trust with the member consistently.
And then on your internal team at Arise, who did you bring on in like the very early days, and how did you think about really building and hiring that foundational team?
The first thing we really focused on was clinical leadership, because I'm not a clinician by training. I come from a product and tech background. My co-founder Amanda comes from more of a marketing kind of business strategy background, and so we knew if we were going to go do this, like we needed to have clinical validity and clinical innovation here. And so one thing we did really early on, because we didn't have any money, we were doing this kind of on evenings and weekends. So we actually just cold emailed and cold outreached a bunch of folks who we wanted to bring on as clinical advisors, people who we really respected, who, we just respected their perspectives. And we were very, very fortunate that there were a number of providers who just said, yeah, this is a huge problem. There's a huge access barrier. This is an awesome idea. And really just early on, kind of volunteered their time and shared their perspectives. And we would kind of go through and brainstorm and like kind of design a care model, review it with them. And then ultimately that became our care advisory board. So we have about 7 individuals across all different disciplines, dietitians, physicians, therapists, coaches. And they were really the start of our entire clinical model. And then simultaneously, Dr. Erica Taylor, who's our chief medical officer, I had been working with her at a nonprofit, and just was telling her about the idea, and she was like, "This is, this feels like it's something bigger than me. That we need to make this happen." And immediately, I was like, "If you're interested, I like, please join us." that would be the best thing ever. And thankfully, she ended up joining the team, and she's really been just a fantastic clinical leader. And I think what's so unique about Erica is her ability to really empathize with the end patient and not just say like, oh, well, this is what the research or the medical literature shows. That's one input, but for each patient, their experience is so individual. We really need to respect and listen to that voice. And, even throughout, she's been I think she just approaches it with such humility. Like she'll ask us, based on your lived experience, like what was important to you, rather than just saying, I am the doctor and this is how we're going to do things. So I think, though the clinical leadership was a really big foundation. And I think second to that was really, security and the technical infrastructure to really build out what Arise could be and make a great experience for patients and providers. So hired our head of engineering, Carolina, who's incredibly product focused and an incredible engineer who'd worked in the healthcare space before, and she's really become like my right hand when it comes to product. And we just get to jam together and have a lot of fun and create really awesome experiences. And I think what's just awesome is of our entire team, about 80% of us have lived experience with eating disorders across all the teams. So I think when we really build from the care model to the engineering to the product, like there's a lot of real lived experience and empathy that goes into it.
So you mentioned a little bit at the beginning, you were working on this part-time. Was this while you were still at Headspace? And would love to just dive in more in general around your career development and how you kind of went from Deloitte to working in tech and now to
Yeah.
launching your own startup.
Yeah, definitely. I was working evenings and weekends, and it was tough for a while, but I think it was just so important, and it was honestly really fun to really be able to rethink honestly like what my experience could have been going through treatment. So I started at Deloitte, and I'd known pretty early on that I wanted to be in mental health tech. And a lot of that was rooted in my own experience going through eating disorder treatment and going through a lot of other treatment for anxiety and depression. And I just knew that there was such a problem here. And I saw it among my classmates while I was at Harvard. And it was something that we were not talking about, but was so prevalent that we needed a solution for. So I started at Deloitte really to get a better landscape of the overall healthcare system. And so I actually was very fortunate to work, a couple of pharma companies, but then also uniquely an opportunity to work with the state of New York with their office of to support people with developmental disabilities and building out their EHR. So I think it was such a unique opportunity to actually work on something that I cared about within a huge consulting firm. And then I quickly realized I'm onto something here. I really want to focus in on digital mental health, and moved over to a company called Click Therapeutics, which is in the prescription digital therapeutic space. And for folks who are not aware of what that is, the goal there is we can actually use software, mobile apps to actually treat diseases and treat mental health conditions. And so that was really fascinating to me because I was like, if I could just do that, I don't have to go see a therapist in person every other week. And what was really cool is they were working on a product to treat depression. So I was the lead product manager who actually launched their first clinical trial product, which is actually they just got FDA approval for about 2 weeks ago. It's called Rejoin. It was partnered with Otsuka. So super proud of that. And I think through that experience, I became a lot more curious about the human element and how do you really build more supportive communities to surround people with. Once they learn these great skills within these programs, how do they really venture back out into the world? How do they really rebuild their social lives and, find community? And so that was really when I came across Ginger, which then merged with Headspace, and joined their team to lead product on the member experience side. So really patient journey. And, how do we get them connected to the right coach? How do we get them connected to the right therapist? How do we really provide digital content that is really suited to their needs? So love that experience. I was so lucky to have such incredible mentors at Headspace. Russ who's the CEO at Headspace, was just so incredibly gracious with his time. So he would, just do regular monthly check-ins with me. And I told him, I don't know if this is a good idea to do. I don't necessarily recommend, but I think at day one, when I met him, I was like, I want to start my own company one day. I know you're an entrepreneur. I would love to just pick your brain. And he was just so gracious. He was like, yeah, let's do it. I want to be able to provide you the resources and kind of advice on what you need. And I think the biggest barrier I had with going to start a company was feeling like I don't have all the answers, or I don't know how to do this. I need to learn. And I think, that's true to an extent, but I think Russ was really so helpful in helping me to identify, well, there are things that you're going to be really good at and that you are going to love doing, and zero in on that. And, find people. The skill set comes from finding people and kind of convening a team who can do those areas that you're not good at and who do it better than you, and really be able to inspire and being able to be aware of what those things are is so important. And I think that really gave me the confidence to say, oh, okay, I don't have to have all the answers. No one has all the answers. We will figure it out, or we will find people to help figure that out. And so I think he was such an incredibly supportive person in my journey to starting Arise.
One, what was had you always wanted to start your own business, and what do you think deep down drove that motivation? And two, what eventually made you be now's the time to go out and do it and feel really confident about going out on your own? Because that's obviously a big decision.
Yeah. I've always wanted to, I think if I had my way, I'd want to be an inventor. I think I just always grew up wanted to create something. And I think I remember in first grade, we had an assignment, and it was to literally write about, something that you would create that is new. And I misinterpreted that. I thought I had to go and create something new. So I was over here trying to build a portable dishwasher. I don't know what the reasoning or rationale was, but that was what I really loved, and really just finding problems and thinking about new ways to solve them. And so that was kind of my DNA. and growing up, I was constantly thinking of just like new business ideas. I grew up in a family that was, I would say, less well off. My, parents, when I was really little, like we were on WIC and like food stamps. And so there was constantly this, I guess, perspective of like the American dream, or like I have to work hard and build something to really advance and like kind of make my parents' sacrifices worth it. And I've gone through a lot of therapy now to like rebalance that perspective. But, I think that was really kind of underlying all of that. And, I think even growing up, like in college, I like ran a dress rental company after visiting Rent the Runway and meeting with their CEO. And, just a lot of like wanting to find unique ways of solving problems and creating better efficiencies. And so, I knew I wanted to do something in the mental health space, but I think I always felt like I wasn't sure what that was quite yet. And I wanted to really solve a problem. I didn't want to start a company just to start a company. Like I really wanted to find something that I felt strongly enough about, that there was an actual big business there to be built. And it's a problem that, our solution can really help people with. And so with eating disorders, I think first and foremost, it was, okay, there is this staggering statistic that 80 to 90% of people will not be able to access care. That's also like exponentially higher for BIPOC communities, for a lot of communities that are historically underserved. And so, how can I really lean in here and use my unique perspective to really be able to do something different here? And I think, I don't necessarily feel like I was ready. Like I think for the first year of even starting the company, I don't necessarily think I was ready. I think I worked with my coach on, I had this constant insecurity of just feeling like there's someone else who would be better at this job. And what was really helpful is my coach shared, there probably is someone better who could do this job. And I was like, well, that's not like, I kind of feel hurt by that. But she was like, no, like that's probably true, but you are the one doing it right now. Right. Like, there's, 7 billion people in the world. Like, of course there might be someone who has like a better skill set, but like they're not doing it right now. Or like, if they are, like, they're not doing it with Arise. And so, you are here and you are doing it. So own that. And so I think that was really helpful to just realize like, okay, it doesn't have to be perfect. Like I'm not going to have all the answers. It's normal to feel that way, but also like there are a lot of leaders out there who don't have all the answers. Like we're all figuring it out. And I think normalizing that was really freeing.
I think one of the best things to realize is that most people out there are literally just taking it day by day, trying
Yeah.
to figure things out. It's very freeing. And
Yeah.
that was amazing advice. So thank you for sharing. And so would love to talk a little bit about your fundraising journey. So you guys have raised $10.5 million seed from BBG Ventures and Greycroft. Can you walk us through your fundraising strategy? What did you learn through your first fundraising process? What advice would you have for others looking to raise?
Yeah, I was so new to fundraising when we first started this journey, and I really credit my co-founder for really leading that effort. I think there was a lot of stuff that I was working through. I think as a child of immigrants who didn't grow up with a lot of money, I think there was this feeling of like, oh, I hate asking for money. And so that was a huge deterrent. And I honestly felt so nervous in a lot of these first pitches. And I was really grateful to have someone kind of by my side, kind of going through it together. I think also as a woman, I felt like I had to have all the answers and I had to be much more prepared to be taken seriously. And there were a lot of experiences, I think, throughout fundraising that were like, frankly, kind of sexist and sometimes a little bit racist. And, I think finding community who we could kind of just go out after and talk about that was really helpful to just validate. It's not a perfect process by any means. That being said, I think, this time around when I went through fundraising, I led that process this time. And I think, having a really strong foundation of an awesome team, awesome outcomes, and really great traction really helped me to just feel really confident going into fundraising. But I think the second perspective and kind of shift that I had in perspective was, our investors are not our bosses, and we're not asking them for money, right? Like it is their job to put the money that they've been, given to, towards things that they believe will have great return. And so if I believe in what we're doing, then I think that we're the right fit to get them that great return. So it really kind of shifted the kind of power dynamic where it's like they're just doing their job, I'm just doing my job. And if it's a fit, it's a fit. And I think, I say this, I used to joke about this, but I think it actually like, I joked enough about it that it became true. But I started to really just view each pitch as like an opportunity to just get to meet another human and to get to know them. And that honestly like was very much the case, and I think it helped me get through a lot of the anxiety and the nerves because I was like, we're just trying to get to know each other, and I was really it was really cool to be able to in that experience find investors who just you immediately click with and who understand it. You don't have to explain over and over again, and those are going to be the people who you're going to want to work with at the end of the day, who really are mission aligned, who are going to be there for the good and the bad, and I think Nisha and Claire and Susan at BBG are really incredible examples of that. I think first and foremost, like their fund really focuses on investing in women and female founders. Such an important cause, and I think they really it creates a meaningfully different space for entrepreneurs and for founders to feel like they're understood and they're heard. Nisha's gone through a lot of the same barriers that we have faced. And, I think being able to talk kind of openly about some of these biases and kind of troubleshoot that together is really, really freeing. They've been supporting us from day one, from like our pre-seed to leading our last round, through all the good and the bad and ups and downs. So, we're really, really fortunate to have them on board.
Huge fan of BBG and kind of everything that they stand for and what they're doing in the world. So they're amazing. Can you touch a little bit more on what you mean by investor fit and like beyond just like the check? What do you look for in investors and like what kind of value can investors bring to you and the Arise team?
Yeah, definitely. I think for us, a big focus is partnerships with healthcare systems, healthcare plans. A big part of our program is being more accessible through insurance partnerships and getting better coverage for our members. So I think for us, a big piece was finding investors who have those connections. I think an important piece was one of our investors who joined this last round. They lead a Medicaid innovation collaborative, so it really allows us to accelerate our ability to expand our services to Medicaid populations because we have their expertise, because we have connections to resources that we might otherwise have to spend a lot of money on. So I think there's like tactical things that, depending on the business, people can be specifically helpful on. But I think from like other elements that are a little less tangible, I think there are some investors who are going to want to be really involved and some who are going to be a little bit more hands off. And I think there's a little bit of exploration as a founder on what is most helpful. I generally like to keep our investors like pretty well informed. So that way we don't get to a board meeting and people are surprised. And I think, we kind of worked into a cadence where it felt like it wasn't too much, but it was, enough where like we get to the board meeting and we can go directly into deep diving on like the strategic, next steps and issues and brainstorming together rather than like doing a bunch of catch ups. And so I think, I've loved when VCs will do kind of like sample brainstorming sessions where they'll bring the full partner group together and just like zero in on a specific problem. And I think that shows like we're trying to actually help you solve a problem, whether or not you come with us or not, or like whether or not we invest. There is actually like we're trying to contribute. And I remember through the process, I met some folks who didn't end up investing just because their fund wasn't the right fit, but then they ended up pointing us to and connecting us with another investor who ended up investing. So it's all just one big network. And so I think to my point on you're just meeting another human, I think it's really just opening up more opportunities and more doors. And so when you stop feeling that, I guess, anxiety of being judged, it really just makes it easier to get connected to the right people.
And as we start to wrap things up, one of my favorite questions, can you share a female founder, investor, or leader who inspires you and a bit about why?
Yeah, there's so many people on this list. I think first and foremost, Anu Sharma at Millie Clinic. They are a maternal care clinic. And, I think Anu has just built an incredible business. And also I just really respect her as a leader and as a human. And she's just given me a lot of source of strength and inspiration. April Coe, I think, is also just an incredible leader. I remember, I think, really, really early days of spring, I had actually been kind of in conversations with her about joining the spring team. And, I think she's just she's such a good businesswoman and also just like entrepreneur and just like is so persistent. And I deeply respect just her persistence and her just tenacity in all of this, because I think oftentimes women are just judged differently in this world, and the strength to really be able to just continue as a leader and lead effectively is really inspiring. And certainly Nisha on the BBG team, I think I've had the fortune to really work closely with her and Claire, and I think Nisha just really it brings such a great balance of tactical advice, but also just giving room and space for founders to build the business that really matters to them. And I think one of the things that I really have appreciated is Nisha really saying like, here's kind of what we're seeing in the market, but end of the day, it's like your business, and we will support you, in building the business that you want. And I think that respect and understanding of, the founder vision, I think is so key. And I think she's like such a badass as like just a human. It's incredible, like, what she's done in her career. And I deeply respect her and want to be like her one day when I grow up.
I love that so much. I haven't had a chance to meet her, but I've met Claire and she's amazing. Finally, where can people find you and where can they access Arise?
Definitely. So our website is www.wearise.com. And the we really can't, it was a cheaper domain. Arise.com was already taken, unfortunately. But I think it really brings this communal sense of like, we are in this together. And really, when we thought about Arise, it was almost like this sense of uprising of like, we are going to kind of overcome the stereotype together. And then on social media, we're typically at Join Arise on Instagram, TikTok, Facebook. So you can find us on all those channels. And I think really importantly, we really try to just make it easy for folks to start care. So you don't have to pick up a phone to call someone and go through this really long clinical process. We really, you can sign up directly online. You can chat with someone on our website. It's about a 1 to 2 minute process to get signed up. And I think what's really important is you don't have to wait until you're sick enough to deserve care. Everyone is deserving of care. Everyone is deserving of, being able to find support and find freedom. And so we hope we can be that option for people out there.
Well, thank you so much for being here for today, for sharing your story, and for all of your hard work on a very important problem. So we really appreciate it.
Thank you for having me. It was such a joy to really meet you and be able to share our story.